Ho ho! Welcome back. Welcome back to episode 1, season 1. We've had 3 episodes before, but that was season 0.
Yeah,
Welcome
season
back to
0.
welcome back to Muscles and Malpractice. We are your hosts. I'm Andrew
Yes.
Bustos,
And I'm Stuart Martin,
Dr. Stuart Martin in the
MD.
house.
Yes.
I'm
MD
excited,
in
man.
the house.
We've we,
Yeah.
we, we've been pumped about this. How many weeks have we been talking about this? We've been talking about at least 3 weeks, really trying to get this going. We're
Yeah.
excited to bring this to you.
Well, we've been talking about this for
A long time.
months. Yeah, going on almost I'd say almost half a year. We at least had kind of talked about this in very theoretical senses, and then an idea formed into a plan, formed into an action, right?
Yes.
Just like everything in life. But this is the finished product. You can expect this every week on the week.
Every week.
There might be sometimes it might not come out on Sunday, but we are going to be very consistent and regular with providing you guys content in terms of trying to talk about things within the sphere of healthcare and fitness that touch on both my world as well as Andrew's. No, we have a
Whoa.
special
Hey.
guest
Hey,
already
hey, hey,
joining here
hey.
today.
Right in.
Hello.
Perfect
There
segue.
is
Start.
my wife. So let me go ahead and at least say a little bit about me, and then y'all are gonna get to hear about my gorgeous wife and she's holding our handsome son there. My name is Stuart Martin. I am an MD and a physician by trade. I did my undergrad medical education at UTMB in Galveston, Texas, followed by a residency at Cedars-Sinai in Beverly Hills, California. I currently work as an obstetrician gynecologist who is board certified with ABOG, and I work in Texas. I happen to meet and marry my gorgeous, beautiful, and talented wife, Katie Martin, who is a NICU nurse by trade and actually is finishing her master's in nursing administration.
That's
I
right.
think
That is correct.
it's very complicated, the things she does sometimes to me. Anyways, that is her and that is my son. And we just kind of wanted you to tell us a little bit about you, Katie.
What I'm doing today or about me
What
in
are you
general?
doing? Yeah, let's just hear about, well, first off, let's hear a little bit about you.
Okay. I think you pretty much covered it. I hate you.
Okay. Well, and Katie, I would like to also give a little bit of background before we get the background on our other co-host here, Andrew, who is a phenomenal human being in
Whoa.
his own right.
Whoa.
You're getting more of an expose on me right on the front end, but my wife is hopefully going to be a very regular guest appearance. And in the long term, when we actually set up more of a studio for myself and the next house we're moving to currently, we're going to hope that Katie can kind of be the lady on the couch in our segments and kind of give us maybe like a little
Yes. I
Katie's
do have a
corner.
lot of opinions.
Yes, just like me.
Well,
And you
Katie's
come from
corner.
a
I do
look,
have a lot of opinions about a lot of things.
Did you say Katie's Corner? Is that what you just
yeah,
said?
man.
That's pretty cool.
You
I like
know,
that.
right?
I like that.
Like, so we got maybe we had to throw in. Guess what, guys? Andrew's wife's name is Kate, dude.
He has a wife too. Because today's episode, we're going to be talking about pregnancy, strength training in pregnancy, and I felt like it was important to get your wife on here because I was going to ask her how you guys look at that? Look what you. She was pregnant at one point,
man,
right?
Yeah,
She
no,
was
right? She's the
look
one
at
who
that.
can tell us all about
She
it
can
with
tell
that
us
handsome little
everything.
dude.
Yeah.
And I mean, again, he was 8 pounds, dude. She pushed him out OP. So she's a tough lady over there.
Nice.
Yeah.
Now
Okay.
he's
So what are y'all doing right now,
30
Katie?
pound big boy. So we are at Chasing Dreams Ranch because we wanted to get out of the house for a little bit because it's a beautiful day. And it is a Highland cow farm. So let me give you all a little look at what we've got here.
No, that's cool.
Oh, there it is. There's cows.
Those are little Highland cows, yeah.
Yeah, here's some little goaties. We actually came out because they have bunnies, so we were doing some Easter pictures.
Okay.
But now we're done.
And that's what do we call that place?
Chasing Dreams Ranch.
Okay. I think they do little events and stuff, right? I'm trying to plug your friend there. So they do events, they do things. So if you look up Chasing Dreams, they can help you with maybe a little birthday party or whatever you're looking to do with a bunch of little tiny cows if you have that on your docket. Okay. Well,
Cool.
I know
Thanks
you're
for
just so
having me,
excited.
guys.
Yeah, well, I felt like it was important to introduce you. I just felt
Yeah.
like it was. I think we had to
Yeah.
get you on here so people could
I
see
Yeah.
mean,
you.
it's never a
I
bad
look
idea to have a
forward
beautiful
to
babe.
joining from the studio and not the farm next time.
Well,
Absolutely.
again, we wanted to just go ahead and do a little early beta test on how the phone interviews would go with the future doctors and other guests we're going to have. So it
Yeah,
looks like it's working pretty
It
well,
was pretty
especially to be
easy.
out there in the middle. Yeah.
it
Cool.
sounds great. Sounds good.
Yeah.
Yeah.
Cool.
Okay, my beautiful
Well,
family.
awesome. Y'all have a good official first show. We're so excited for y'all.
Oh,
Thank you very much. All right. We're going to kick you out of here now. See you.
Awesome,
All
awesome.
right.
Yeah, like so touching on today. So what we're going to be talking about in this podcast episode, we're going to talk about strength training during pregnancy because there's a lot of misinformation out there, Dr. Martin. Some say you shouldn't lift weights at all, while others say it's perfectly safe. So we were going to talk about what's the truth. What's the truth? That's
Well,
what we're
I
gonna
feel
do.
like we still need to hear a little bit about you, Andrew.
I know. Well, I'm gonna
Yeah.
we're
Okay.
gonna go into
Okay.
there.
Okay.
We're gonna get into that. So let me tell you a little bit about me. So who am I? My name is Andrew Bustos. I have been a fitness personal trainer for almost 20 years. Can you believe that? 20 years. That's a long time.
Yeah.
So
can.
I have no there's no MD, there's only a personal trainer. That's
It's a
it.
bachelor's
Okay.
degree, man.
It's a
That
bachelor. I
ain't
do have a
that ain't
bachelor's
no
degree.
small thing
I do have a
either.
bachelor's degree. I do, but it's in history though. So everything that I know so everything that I do
love
and
me
everything
a
that I
history
know.
dude, man.
Yeah,
Yeah.
dude. That's why
History
that's why
Channel
we
is
get
my
along.
favorite.
Yeah, that's why we get along. But I've been training over 20 years, almost 20 years, and I've trained all shapes, ages, sizes of people. So it doesn't matter injuries. I've seen pretty much everything. I've had my own injuries. So it's definitely whatever it may be, I've trained it.
Mm-hmm.
My family's a little bit bigger than Dr. Martin's, but we have kids from 23 all the way down to almost 4. So there's 5 of them.
Mm-hmm.
And keeps us busy. So that's what we do. And like you said earlier, my wife, she's also a trainer. She'll be on the show, maybe here eventually. Not as much as Katie, but she definitely will make some appearance, and you'll get to see her and her perspective. And she also works with a lot of ladies. And not saying that this podcast is only for women, but my specialty is I've trained a lot of women, I've trained a lot of men, and it's just all in between.
Yeah. Yeah, I mean, I think both of our interests fall towards, fitness and health in general. And even though I want this to be a resource both to my patients and my field of expertise tends to fall into women's health, I think it's something that I don't want to kind of define either this show or define what we talk about. Because again, outside of work, especially, I'm always happy to talk to patients about that stuff. But like, I like to talk about health as it relates to me a little bit too. So,
Exactly.
yeah, again, it will be a thing that we try to carry show to show at least some little emphasis or spotlight into women's health, but it will definitely not be always even the focus necessarily of every episode.
Right, because there's 2 dudes right here. We're 2
Yeah,
guys.
yeah.
We're men. We're
That's
talking
why we need
about
Katie's corner, dude.
That's
Otherwise, you
right,
have
dude.
no freaking
That's right,
validity
yeah.
whatsoever.
Yeah, we do I mean our specialty, like you just said, we I mean it's women, we're
Yeah.
we're 2 guys, but we have
Yeah,
to really
two dudes talking about women's health care usually isn't going to carry over too well.
Right.
Just even if one of them is an OB-GYN, it's best that we kind of stick to our our roles in some level.
Exactly. All right, let's hop in here.
Okay.
Let's
So what are
hit
we talking?
this.
We going to talk about exercise and pregnancy?
We are. We're talking
Okay.
about exercise, strength training,
Okay.
whatever. I mean, I feel like there's a lot that fits into exercise. So I think there's a
Yes.
lot of things that you can do, especially like we can talk about strength training, we can talk about cardio, we can talk about
Yes.
core training, all those things.
Well, and so here's what I also kind of want to just before we get running down the road right now in this stuff real quick is I want to kind of explain to viewers and listeners is that we're going to try to keep this a little bit segmented for you guys' sake as well as our own. Again, this is going to be every week, so you can always plan on kind of a consistent episode basis. And not always, but at least to some degree, we're going to try to keep like a theme for some period of time. And so for what we're thinking is going to be about a month over month, usually, we're going to try to carry a theme among the episodes.
Mm-hmm.
Today and for the next few weeks, we're going to be talking about pregnancy as it relates to fitness, exercise, muscle gain, muscle loss, physiological effects, postpartum, the things around pregnancy that are exercise and fitness related, just because it's a good place to start, I think. So, yeah, with that being said, I think today what we're really going to try to emphasize out of that whole bigger topic and subject header is to really talk about the actual exercise of what we recommend for pregnant women and some of the pregnancy related issues around exercise in pregnancy. So not just fitness, exercise specifically. And so like that tends to be one of those topics that, again, I've had the gamut of like elite athletes. Like, I have college athletes that are D1 athletes that have a very different perspective and thought about their kind of continued exercise regimen when they get pregnant, versus something that we see a lot in pregnancy, which is people who are already kind of complacent and not really doing much exercise and still kind of wondering, like, or thinking that exercise is not safe for them in pregnancy. It's just like the idea of what we know to be category A, super safe things to take in pregnancy that people kind of resist taking because they just don't want to take a medication while they're pregnant. So let's just start with,
Yeah, because
I'm going to start out here, guys, and then we're going to get technical. We're going to get nitty gritty.
ooh,
You're going to get the relatable actual regimens and some ideas of like what you can Google. Because, what Andrew's going to do is go like, do a Bulgarian split squat times 10 times, blah, 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 blah. And you're not going to know what the hell that is. So you're just going to have to Google it, okay? But he's going to give you the terminology for stuff or just general concepts to stick by to implement the exercises that we're kind of saying are the prescribed regimens. So one of the most common questions I get asked when women do come to me in pregnancy is it safe to work out while you're pregnant?
ooh.
And the short answer is yes, it absolutely is. And not only is it safe, like we recommend that. So it's one of the most powerful tools we have that we can help better our health. And that's always going to hold true even in pregnancy. There's
So
a
do you
lot
think?
of...
So let me
Mhm.
ask you this. I'm going to cut you
Mhm.
off real quick. I'm sorry
Good.
about that.
No.
So do you, with your question, do you ever get people that are like, "Can I start exercising now, even though they've
Yes.
never exercised?" Like,
Right,
do you ever
which
get that
is
one?
it's sorry, I'm messing with my headphones here a little. It is a little more uncommon for people suddenly to get the initiative, especially, we have an obesity epidemic in this country. We definitely have an issue with people, and that's getting better a little bit, let's say, but I do think we have a complacency issue in general a lot of times with a lot of younger people. That the benefit of pregnancy is it tends to be a problem of the younger, right? So you don't tend to find people as potentially high BMI or less active, but there's definitely plenty of people who are like, again, it's rarer to see the initiative start with pregnancy. Like, oh, now I'm 10 weeks and I may have some morning sickness, but like, can I get on a treadmill? So that's a rarer thing, but you see it.
So you're saying like, if you come in, you get pregnant, you haven't worked out in 10 years, or let's say you're 20, even if you're 30 years old and you haven't worked out since you were 20 and you got pregnant, it's your first pregnancy. Do you have people come in? They come in and they say, "Hey, I'm thinking about starting exercising." Is it like something that
Rarely.
happens? Okay,
Rarely.
I got
Like,
you.
I mean,
I'm with
again,
you.
I could probably count that on like one or two hands
I got you.
most.
Yeah.
But to speak to that, I tried to review some articles. And so, again, that's what I kind of have as synthesized as notes to say. And one of the
Awesome.
main things I had on our hook that I had as a hook for this whole topic was 60% of pregnant individuals in the US don't engage in moderate or vigorous activity while they're pregnant. So
Dude,
2/3 don't even do it.
that's crazy because I read a stat the other day too that 70% of people, and I'm not talking pregnancy, don't even do anything.
Right.
And that's
I'd
crazy.
believe that. I would believe that.
Don't even move.
Yes.
And like, don't even
Just
get
lay
off the
there.
couch. Don't even go for a walk. Like, that's
Right.
just bizarre to me. So
Right.
yeah, that's a great stat. That's an awesome stat.
Yeah. Kind of reminds me of the movie Wall-E, dude, where he like gets to that ship and like
Yes.
nobody's moving at all. Is that
Yes.
Wall-E? Yeah, I think that's
Yeah,
Wall-E,
yeah,
right?
yeah.
Where they're on the cruise ship and like everybody doesn't have to move at all. Anyways, a lot of people also stop working out out of fear or like aren't sure where to even start. And it's really just not that hard. And I will say again, so we said 60% don't engage in moderate or vigorous. Fewer than 15% of pregnant people meet the recommended 150 minutes of moderate activity per week. And what that breaks down to is about 30 minutes of moderate intensity exercise 5 times a week. You can do it 7 times, but again, you don't have to do 30 minutes for 5 times. It's done so simply for you. They say just do 150 minutes of moderate intensity exercise. Okay?
That's not even that much.
Now,
Wow.
no. It is better to space it out
Yeah.
evenly, I would
Yeah.
say in general. We can go over that moderate intensity idea. I would like to do that.
Mm-hmm.
But before we even get to that, I just kind of want to talk about some of the pregnancy related things. So it's no surprise that this is going to do a lot of the same benefits for your pregnancy and you that it would do outside of pregnancy. So again, it's going to give you better cardiovascular health, strength, flexibility. It's going to give you better mood, energy, reduce your stress. But here's the pregnancy related benefits. Okay. So you're going to get a reduced risk of excessive weight gain as well as gestational diabetes. You also have a lower risk of hypertension and preeclampsia. And the odds ratio on that is 0.54, meaning you basically half your risk of having a hypertensive disease while you're pregnant. The other thing that's kind of it's a harder stat to really bore down on is this idea of the risk of large for gestational age or macrosomic babies. That is something that every pregnant woman like stays awake at night wondering if they're going to have a 10-pound baby or not. And like, so it does reduce your risk of an LGA baby, like so a large baby. But
LGA. That's cool.
yeah.
Tell me again. So I don't know much. I don't know much about this, but I know women that are listening to this are like, oh, yeah, right. But being the guy, you just show up to the appointment and you're like, oh, there's the baby, you know.
Well,
So what you said something earlier too. You said gestational. Is that you said diabetes? That's
large
just
for gestational age or macrosomic babies.
okay.
So
What's the macrosome? What does that mean?
Macrosomia, that's a technicality. So I hope again, 2 things. This is getting into real minutia of
But-
medicine.
Yeah.
Large for gestational age babies is after the baby is born, and that's what a neonatologist or a pediatrician is going to label your baby, or the nurse who delivers is going to say, okay, this baby's 5,000 grams and you delivered at 38 weeks. That is an LGA baby. But macrosomia has to do with the fetus. So we don't actually label a baby as LGA technically until the baby's born. Macrosomia has to do with the baby measuring big in utero.
Okay, gotcha.
But both of those things are reduced in risk before with this exercise regimen, right? With this 150 minutes of moderate intensity exercise. I think the biggest thing to take away from that, though, is there's like no improved rate of having an appropriate for gestational age baby. There's like this duality of statistics, which can really mess with you. So, what I would just in general try to take away, the biggest thing that I think people don't realize, and it truly, one of the motivating things for people, especially first time mom, how big their baby is going to be and if they're going to have a vaginal birth. And guess what? You're more likely to have vaginal birth if you do this exercise regimen. So,
yeah, because you can actually push it out, right?
right. I mean,
you're
it's been
strong
shown.
enough to do it. Studies
Yeah,
have been shown, right?
It has like literally. So there's even some studies with like, extreme athletes and, high performance athletes and just the ability to push. But it just in general, you have to also understand that a lot of these factors are all interrelated, right? So somebody who's more likely to have gestational diabetes is also more likely to have a macrosomic baby. And also they have a higher risk of things like hypertensive disorders in pregnancy. So it's all interrelated. And again, exercise, like just healthy, modifiable lifestyle habits, right? Like it always boils down to that stuff that gives you the biggest overall, just general risk reduction and benefit. There is another common problem for people is lower back and pelvic pain while they're pregnant. Exercise has been shown to benefit that as well.
Well, yeah, because I mean, as you're saying all this, I just think about just like I said earlier, just get off the couch, go for a walk.
Right.
Get up
Right.
and
And
do
that's where
do
it can
some
start.
very basic things.
And so let's go there now to start with what we really need to think about here. So, with people who are starting this out, moderate exercise is safe for almost all pregnant individuals. There is some people who it is contraindicated in. And again, I'm not going to go through that whole list. It's very specific and very niche, actually, where you cannot do anything whatsoever. So, talk to your provider, either your midwife, your OB, whoever, about whether it is recommended for you to be pregnant and exercising. But almost assuredly, you're not going to be in the group that gets to get out of saying, oh, it's best that you don't work out. No, almost everybody can still work out. I think the biggest things to take away are understanding with joint injuries, you can have a higher likelihood of having a joint injury just because of the hormonal changes that the elevated progesterone makes your joints more lax, makes them tend to stretch more. So you're at a little bit higher risk for actually having either tears or sprains on your ligaments and tendons. So you just have to be careful with that. The other big thing that we just don't recommend is like things that have a high risk of abdominal impact or trauma. So you don't want to be doing contact sports or high risk activities. A lot of people talk to me about riding horses. That technically is not the best idea. Definitely things like skiing.
Well, you're like going up and down, man. That's a lot of.
The
I
other
would think
thing,
that would
well,
hurt.
you could fall, man.
Yeah,
You could
and you could
fall.
fall off the horse too.
So the other things that like are kind of like an absolute no, weirdly. So just to get into two really niche situations, scuba diving, never. Never, never, never. I know scuba, like I've seen scuba outfits before talk to them about this and they won't let you do it anyway, but you cannot scuba dive. There is just issues with the way fetal pulmonary circulation works. They cannot handle that bubble kind of potential
Has anybody ever
formation from
asked you? Has anybody ever been like,
dude, I'm
no,
trying to speak
please?
to it all, like,
No
because
way. People,
scuba is just weird. And here's the thing is like it literally it can cause your baby to get decompression sickness, which is weird. And people just don't think about that stuff.
like, why would you? Okay, let's go ahead and go in the water, and I'm gonna go ahead and go cannonball. Here it is.
Well, I mean, in some ways, the thing I tell
Crazy.
patients about their babies is that your baby is like a little scuba diver inside you because they have their little freaking umbilical cord, right? So they're getting their blood flow from you. I like it's just not safe. Weirdly, along those lines, what they tell people is like lowlanders. So people like us in Texas, you should not be going up to Colorado and then working out day one. Because the way your oxygen, you're in a lower oxygen environment, you're already going to create an oxygen deficit for yourself and your baby. The idea that you would then go work out on top of that is an absolutely terrible idea.
Well, really? So even if, like, let's say you take a vacation to Vail, Colorado or something, and you decided, hey, I'm gonna go do some strength training or walk on the treadmill or something. You start feeling dizzy.
Not a great idea.
That's not good to continue. Huh.
So you actually really need to wait like 3-4 days for your own body and biology to acclimate to that altitude before you pursue any kind of strength training.
I've been learning a lot of things with you.
There you go, man. So other big thing that I think goes into some other health risks and problems is hyperthermia. So this is the idea of like doing like hot yoga or these long workouts in like hot and humid environments that have gotten really popular. Not a great idea because ultimately heat is one of the biggest teratogens and it's just not good for babies in general. So we like getting over a 102 temperature in pregnancy is very bad.
What's a teratogen? I never heard that word.
Oh man,
What is
that's
that?
like a exposure or kind of it can be chemicals, it can be drugs, it can be environmental factors such as heat that cause congenital abnormalities in the baby. So especially in the first trimester, we talk about teratogenic effects, things that could cause organogenesis, meaning the formation of organs to not go properly. So it goes along the idea of like people like I just don't know why people do have to ask this stuff because again, I think a theme of our show will end up always being like freaking use your head, like common sense, right?
These
But
are
like
questions that are asked. Yeah.
I know, but like going into a hot sauna or something, like you should never be in like a hot tub or anything like that for more than 20 minutes when the temperature's over 104. You increase your body temperature too high and you're going to risk affecting your baby. And people don't think about that stuff as much as like, oh, I shouldn't take Tylenol right now, even though it's category A.
Well, what about like when you see what I see in my world is like you get on Instagram or you get on TikTok and you see some woman with a big old belly, and she goes and grabs that barbell, and she's doing, you know, bar snatches overhead. She's doing cleans. It's like hitting the bottom of the belly as she brings it up. And granted, she's in pretty good shape, but is that safe? Is that like something that I'm sure your patients have been CrossFitters or
Okay,
weightlifter,
so
like power
and
lifters and
now
things.
you're talking about the special population.
Oh, we're going. Oh,
category.
yeah, that's
we're
right.
Going
We
special
Oh,
population.
we're going the outliers. You're right. You're going
All
general
right,
here.
so you want to talk about elite athletes?
Man,
Now, you want to talk about elite athletes? Do we want to talk about that? Generally, the rule of thumb is, and there's only some very small, you know, these studies have like 10 people in them because, again, you have to have elite athletes that are pregnant. So
yeah, you
we don't have
there's
great
not very
data.
many. Yeah.
But in general, what's been shown is that they can generally continue the training that they have with supervision. They will voluntarily decrease their exertion over time, and especially into the third trimester. Meaning, like, you're not going to have the energy anymore to basically
To do what they were
doing.
Yeah.
And I'm not saying that's the only thing that matters, because I do want to give you this really weird and crazy fact I did read, and I thought was so cool. There have been 14 verified pregnant Olympians while they were pregnant. And at least, I think they said 3 have won medals.
Well, yeah.
So,
The girl from the woman from University of Texas, the sprinter, she
was she pregnant at the time?
she was pregnant. She came in.
Damn, there you
We
go.
were attending Beltway, the church here in town, and I guess they had her in or had her talk, and she was pregnant when she won the gold medal.
Yeah.
Sonia Richards.
Okay. I just
That
thought
happens.
that was so
How does that
crazy.
happen though? Wouldn't they be like she would notice that she was fatigued and tired and like?
So yes, you are going to have some physiologic changes, and it is like there is some weird trade-offs. Like, I mean, again, we talk about things like that joint laxity, right? So even just the joint laxity, like if you think about the best example I read about was kind of like a tennis player. Like a tennis player, if you get into the second trimester, late second trimester, you're not going to be able to stop on a dime and like move as quick. But then what ends up happening is those athletes almost compensate with more dramatic, over exaggerated movements, and that can then lead to injury. So you do have to be careful about competition. So, you know, when we talk about what is recommended for the general population, this 150 minutes of moderate intensity exercise. We usually, I know you know this thing just as well as I do, is like you can relate it to patients with this kind of talk test thing where you talk about like, you know, severe or I guess high intensity exercise means you can't even talk someone hold a conversation. You are going to sweat through those things. What you talk about moderate intensity being is that you basically can still hold that conversation. I think one thing I saw that kind of helped generalize is you can't sing. So you
that's a
can't
good
like
one. Yeah.
sing, but you can talk.
Yeah, it's one of the things when we first started training, it was, I forget what the exact test is, but it's like rate 1 to 10. And if I'm training someone and I go, hey, so out of a scale of 1 to 10, how do you feel right now? And they're like, well, I feel like it's at a 2. Okay, well, you can push it a little bit more. Where are you at now? I'm at a 9. Okay, let's back it down. Let's bring it down.
And so, you know, going into that a little bit, there are some scales out there. So getting away from like the routine person, you're talking about these elite population people again, and they're going to be elite in the way they train already.
Yes.
So that's where you would get into things like the Borg exertion scale, where you have like 0 at rest to 20 is like your peak. You also have things like METs, you know, like a lot of things like heart rate monitors do that. One of the best actual verifiable kind of metrics that's been shown that we actually have some data on is avoiding a greater than 90% VO2 max intensity. So there's no proven benefit for the elite athlete at training above that. And there's also some fetal risks that have been shown at that level. And that kind of goes back to this idea of like a lot of what you need to worry about with pregnancy and exercise is just making sure that you're not creating. It's kind of one of these things like you don't want to deprive, like if you're having trouble breathing, that is the oxygen pathway that is going to your baby. The oxygen you breathe is being stolen from you in utero from your baby steals it from you. So if you can't compensate for yourself, your baby might be
Oh
struggling a
yeah, the
little bit in
baby's
there.
going to suffer. Oh,
Right.
that's a great analogy. And I know I pushed you here. I definitely pushed you here with the Olympic athlete and things. You were doing more generalistic, but that's a great point. I didn't even
Well,
you don't think about that. I don't.
well, right. And that goes also to what the recommendations are for like an elite athlete versus a routine run of the mill person. You know, they talk about too, one of the things people won't know that you probably should do outside the first trimester, avoid supine position workouts. So you really shouldn't be laying on your back doing a lot, because there's the chance that you could have what's called aortocable compression, meaning your uterus is going to push on your aorta, which is the big blood vessel that goes into your heart, and you're gonna stand up from that seated position. You're gonna freaking basically be dizzy as hell, see stars, and that puts you at risk for fall.
So
So you really
the
should
count to
avoid.
5 isn't going to work when you stand up. You'd be like 1, 2, see you later.
And they also talk about the idea that you really don't need to do anything over 10 kilogram weights. Like it's really more about high rep intensity as opposed to high weight intensity for the average person. Now, that being said, there is no problem, even as they've shown in studies with women who are like weightlifters, like you're talking about, and them actively valsalvaing, meaning like they go. Now, they ideally should be trying to exhale as they lift some heavy lift, like as opposed to. But at the end of the day, there actually in that population, and I think you should know very, very damn well whether you elite athlete or
If
not.
you're
Right. So, and again, I have been around those ladies before. I have taken care of them in the last 10 years. I have also, nursing world, there's a lot of intense health and fitness people in the nursing world who are nurses. I've seen bodybuilding nurses who have been pregnant and continued to bodybuild through their pregnancy effectively. That being said, I will say, probably one of the best things to do is to think about ways that you don't have to reinvent the wheel. So I do think extra strength training is great, but like stationary cycling, walking on an incline as opposed to jogging, these are like always going to be like the better options that kind of make the most sense and are the most safe. I also will say, like, one of the biggest things too that they talk about over and over again in the data, which not everybody's going to have access to, aquatic.
really
Aquatic stuff is great, dude, because again, you're gonna lose all the problems with weight bearing. Not gonna be getting supine, and so like aquatic exercise or doing a little bit of like kind of chill swimming, not necessarily trying to get Michael Phelps up in there with a
you're not
pregnant belly going. Like,
you're
you
not
don't need to
diving
be
off
like,
and
yeah, none of that. You just need to be like trying to get in the water and swim around and wait around for like 30-40 minutes.
that's a good point though, because I think my mom did a lot of swimming um, whenever she was pregnant with my brother,
Mm-hmm. Mm-hmm.
and she's always been active though, but she did a lot of swimming, and then she might have gotten real sick with him, but that actually helped her,
Yeah.
from what I remember, over
Yeah.
30 something years ago.
Okay, and then yeah, 30. I mean, she knew what the hell was going on before everyone else did.
And
Man.
that's probably another thing though too, is I think sometimes, you can correct me if I'm wrong, but I feel like some of the old school mentality, just keeping it simple and finding what works best for you, like we were talking about common sense. I mean, is
I
that
mean,
probably
it's
that's
just
probably
what
because
it is.
I think that there's a point where there's too much information. I think,
Yes.
do you ever feel like there's just
I
too
mean, I
much?
do, and that's almost, we're getting back into like one of the reasons I feel like this podcast was so like I just like talking to you. I just like talking about stuff in general, but like, man, I just feel like nowadays I'm so much on the defense with social media that it's time to like just put more out there on social media to proactively fight the misinformation.
Well, so you're talking about when patients come in, they're like, "Oh, I saw this on TikTok or I saw this on
Right.
Instagram."
And it's just and there's a theme, I swear, with like every week where it's like now it's the fourth patient of the day that's going to bring up, oh, let's talk about vaginal seeding today, or let's talk about this today. And like, we're not even going to get into that topic I just said there. I'm just telling you, it's like, it's just some
It's just whatever
stuff.
we've seen.
Right. And so then it's like, okay, the algorithm spoke to every one of my patients this week and showed them all this one thing that now I have to, I get the, the talk back. It gets pretty easy back, but it is one of those things where it really does boil down to common sense. I always tell patients it's not your job, it's mine to like make sure you understand these things and to answer questions and to make sure you take care of yourself. So it's a simple in the moment thing of common sense, but then writing your questions down, bringing them to your appointment and talking to your provider about like, hey, I was thinking about this, like what do you think?
Right.
That's what your doctor's there for, and I just hate that, both common sense and listening to people who like have no interest in mind other than making sure you're taken care of, not clicks, not friggin'
Right.
sponsorships,
And they've never delivered a baby in their life, but yet they're telling you they've never
but they're
taken care
telling
of
you
a
their
patient.
experience.
Yeah.
And that's what's so hard to get across to people is like, just because that happened that way for that patient doesn't mean it was safe, doesn't mean they weren't risking things, doesn't mean it was the right way to do it, and doesn't mean it was right for them. I mean, that's truly the biggest thing. But common sense, man, it's just not common anymore. And that's what I beg people to the best of their ability to just stay safe and use your head and then talk to me about it. If you're still like, I don't know, I haven't, like, Googling it can kind of lead you down a road that's a
You don't
lot
want to
worse
go down
than
that road because it does. Even like when someone's sick, it's like, hey, I think I have this. When
yeah,
it's just like, dude, you have a sore throat, bro. That's all you have. But that's what, because even so, I'll give you my perspective on just not necessarily training, but as a dad, as a spouse, someone that's been there around the room when your wife is very active, but then trusting the physician to
yeah,
do the job. Because I remember
right,
going into these things and in these appointments, and we'd be like, what should we do? Like, what's the next thing? It wasn't like, hey, I saw this on YouTube and I want to, and none of that. It
right,
was strictly like, you're the expert.
right. And I still think there's an element of those people out here in this generation. I do think it is. I think truly, I have appreciated the idea of generational characteristics more as I've gotten older. And I just think, and it's not a slight on, it's something I encounter more than probably any other medical specialty because I continue to see the youngest generation come up, right? Like, so now I'm delivering mid teenagers sometimes into mid 20s. And that was what I was delivering mostly 5 to 10 years ago, too. So you start to see how
They change. It's
each
different. Yeah.
generation kind of interprets, synthesizes, and communicates information. And I do think there has been this kind of, I don't want to say that it's malignant. It is some kind of idea of trust nothing, verify everything, and the information is available for you to learn and be the expert on. And we've given less traditional credence to traditional experts in what anything is because
Yeah.
we doubt everything, because again, you just have so much, it's just, like you said, it's just so much information, like so many people out there trying to talk, like even just us on here, right? Like we're just one podcast among many that's just saying whatever we're saying, and how do they know what I'm saying is any more accurate than anybody else? And like, it just becomes that's why I think it's important to start putting more information out there, because again, it just becomes me feeling like a broken record when I'm speaking to my patient population,
Right.
that they're all getting this from like one or two videos
And
again.
yeah, and you said something earlier too. You said something about bring in your questions, ask
Yeah.
questions, and I
Yeah.
think that's important too. I always, when a client, the first clients that I ever meet, and it's like within an assessment consultation, I think it's great when they come with a list of questions because I know that they really want to know, and they really want to know, what do you think? What do you think? What do you think? What do you think? And they're bought in. I think that's a big
Yes.
deal.
Yeah, and I also would say too, to that point, I think one thing that really does matter is, especially with a physician, and I know it's weird, with OB, people come in with a little bit of modesty in mind and they get embarrassed about asking certain questions. And I've noticed that over time, is like sometimes patients won't ask me things that I think they want to ask. And I'll find out that they asked my nurse practitioner as opposed to me. And
Is
I
that just
just
being a
wish
guy?
they
Is that just being
would.
a
Well,
guy, or
I guess, I don't know. It is kind of funny how that happens that way. But like that, I just wish, any perception of judgment, I know that can be out there with certain providers. I wish that wasn't true, but I think we should always kind of come into the people that are taking care of us, especially for pregnancy, and trying to assume that they're doing what's best for us and assuming a place of non-judgment. We're like one of the only safe places that's literally legally upheld in all of the world, right? Like the idea of HIPAA, and that you can kind of come in and your information is legally protected. We're supposed to come from a place of non-judgment. I don't know if every OB does. I hope they do. And for the most part, I've never seen that not to be true, but I know how that could still be perceived. And we do so much through like body language, sometimes misperception, maybe even, of just us having to take in information and then try to be like, look.
Right.
Because again,
Yeah.
like, just to use another example again, it's this idea of like vaginal seeding, which is like this idea of cesarean birth babies getting exposure to the vaginal biome by swabs that they put on the baby, like they wipe themselves. I've been talking to
Wow.
my nurse practitioner about this a little bit. Apparently, there's not terrible data on this. I need to do a little more research myself. It sounds a little kooky, but it also has a little bit of basis in science. And so, like, you know, I may kind of go like, what? If you like bring up something to me I don't really know.
I just did it. I just went,
But,
"What?"
right. But like, just give me a chance. Just like, talk to people about what your reservations are, what your concerns are. Because if we don't know, there's no way for me to address it either. I guess the only two other things I really would bring up today about exercise in specific scenarios, just to kind of hit the high points so we can move on to just the ad lib portion of the episode, is postpartum or the purpurium,
The
postpartum, and also breastfeeding. Those two populations have some interesting things to kind of recommend. With vaginal births, man, those women, they're so lucky, because again, it really just comes down to like resuming activity at your own pace. Generally, we're kind of like, okay, take it easy the first week, like, take it easy, but like,
Take it
you
easy, man.
really can get pretty much back to it at your own pace. Just again, common sense. I don't even know that I can tell you much more than that. The general recommendations are to resume activity at your own pace, but you shouldn't be overexerting yourself, obviously. That being said, with a C-section, again, within 1 to 3 weeks, you can start doing things like walking and light activity. And a full return to training depends on incision healing and strength recovery. One of the things I think people need to understand is that you really should not be lifting over the size of your child after you have had a C-section, you had major abdominal surgery. One of the kind of metrics we use in medicine and surgery is the idea of like what time frame to return to tensile strength, right? So like a good example is like where you usually are going to see the fascia, which is the thing that keeps all your guts inside your stomach under your skin closed and is the functional surgical layer. When that gets to 50%, half of what you normally were before your surgery, that's at 42 days. So that's like about a week over a month. And so we're usually telling people at 6 weeks, hey, you don't have to worry about, pelvic rest anymore. You can get back to working out in the gym as much as you want to and push it as you can kind of tolerate. But truly, it's not even to like 120 days that you're getting close to like 80, 90% of your tensile strength. So back to basically your baseline where you may not pop a hernia. So you need to be careful. If it is surgery, it is going to be a slower go. It is going to be a slow recovery. Don't try to push that too fast.
Yeah.
The next thing,
Man.
people won't understand, like ever really think about this, but it is a huge little like extra factor and thing is that you should breastfeed once you're postpartum. You should breastfeed before you work out. And the reason being is that you don't want to deal with breast engorgement and pain while you're working out. But here's the kicker. If you work out real hard, you're going to end up building up lactic acid in your blood. And that lactic acid is going to go into your breast milk. And your baby is not going to like that lactic acid in the breast milk. So it actually ends up causing more breastfeeding issues. It has no impact on breastfeeding. You can exercise all you want. Just please pump or feed before your workouts, and it totally has no impact. It will not impact your production, your baby's ability to latch, all these other issues, unless you like basically cause like lactic acid to get lactic acidosis breast milk. I mean, that's not a real thing, but I'm just giving you a joke term for it. But it's
Dude, I've
you don't
never
want
even
to tell
heard
them.
of that, but that
Yeah,
that
dude.
makes sense. I mean, that
Yeah.
would make sense. I'd never even that's never, at my ob-gyn appointments that I went to with my wife,
Well,
I never heard that.
You know, I got you, bro. I try to
Dude, that's
explain
pretty
it all,
cool.
man.
Good thing
Yeah.
no more babies for me. I probably would have heard it if I had another baby, I guess.
Bro, you want to know what I found out recently? Can I just reveal a little bit of private health information on you?
On me?
Yeah, on you, bro. Because you've shared
So
this. I mean, you
you're
said no
gonna
more
you're gonna
babies.
you're gonna
I'm
HIPAA me?
gonna
You're
out
gonna
your. Can I out you?
I guess so. Go
No
ahead.
more
What are you gonna out me
babies.
with? Yeah, there's no more babies.
Okay, right. How is
Yeah,
that
dude.
possible? How is that possible?
Yeah, I had well, there's a thing called it starts with the letter, was it a V or is it a B?
Okay.
I don't know.
Okay. So
If
you
you're
got a
under
vasectomy?
if you're
Did you
under
get a
3, you'd
vasectomy?
be like,
Did you get a
I
vasectomy?
did. I
Okay.
got one in
Okay.
2021, I think, or yeah, 2021, something like that.
Okay. So I have a question. Can
No.
you still
How deep is this question?
can you still feel the suture?
No, I can't feel anything.
Are you sure?
Yeah. Oh, because you're asking, because you're on the. You got your appointment Monday. Is that what you're asking? You're probably asking about your appointment on Monday.
No.
Yeah.
No, I was reading recently that they use permanent suture once they ligate because again, a vasectomy is ligating, so cutting the vas deferens or the little tube that carries the spermies out the urethra to the urethra and then out the urethra. And when they cut those or ligate them, then they suture each end of the vas deferens with suture, right? Like with a tie, like sewing. That's surgical sewing for us, right? But they use permanent suture, so things that won't absorb. So you literally have like little bow ties in your ball sack right now, in case.
Hopefully that bad boy don't come
case
undone.
It won't. Like it'll scar over and it's already separated. But the point I was reading was that they leave it that way so that in case you decide to go back on your word and you're like, I want another baby.
No,
that the
I'm
surgeon
not
can
going
go
back
in
in.
there and find that freaking bow tie, the actual permanent suture ligature, and actually find it to reanastomose it or reconnect it.
Snip, snap, snip, snap. You know what that does? You know what that does to your.
You know what
Michael
vasectomies do to a man?
No way, dude. Exactly. I couldn't even imagine going back in there.
So I already know what I'm telling my urologist. After number 2 comes for us, I'm gonna be like, dude, I don't want to feel my bow ties in my balls. Please just use absorbable suture because it's gonna freak me out to feel a little worm in my balls.
No, dude, I don't go. I haven't felt that or done anything around that area. All I know is the traumatic event. I just took care of it.
Oh, they're putting me
got
out.
it done,
dude.
and
they're putting me out.
And no, they're not gonna put you out. You need to sit there like a man. Yeah, and to all the men out there listening to this and never gone through that, your poor wives, you need to be a man and get it done. Calling you out.
All right.
But
So,
yeah, no, we went off on this. We went off on that. That's pretty. Yeah,
but
the world knows now.
I'm going to ask for the Andrew response now to this whole topic. I want you to give us a little bit of a workout regimen based off of what we've kind of talked about now.
Yeah, no, I think this is good.
So go for it, dude.
And you know what's funny is I was going to segue and go, everything I'm about to tell you, I'm sure Dr. Martin's about to tell me I can't. So let you do this. Just kidding. But everything that we have, it's pretty. And the big thing as a trainer, as a coach, whenever someone comes to me and they tell me, and you can always tell, which is really funny. I could always tell anybody that got pregnant that I was training along the way. I could just tell something wasn't right, but they got to that point. What is it, like week 8 or 9 when you can? I don't know what the superstition is, but like 8 or 9, they're like, I can tell people now. I don't know. I don't remember what that is. Maybe you can tell me what that is. But I just remember about weeks 8, 9, 10, and they would tell me, and then they'd go, hey, I just let you know I'm pregnant. And I'm like, I know. I already know it. How'd you know? I said, because I can tell just how your energies, you're not as like pumped up. You're not moving as well. Like you're just not doing it well. So anyways, Dr. Martin Calling Dr. Martin? I don't know. We'll keep going. I think Dr. Martin will be back in a minute. Oh, there he
I'm
is.
there.
There's Dr. Martin. He's back.
Sorry.
Sorry, dude. You took off.
I had a little to go to the boys' room real quick.
Oh, you had a little technical difficulty. I was like
Yeah, a little
looking and I go, oh,
technical.
wait a minute. You're gone.
I'm
But
good.
a lot of things that you can, a lot of things, it's really anytime that you're working out, even if you're working out right now, like we touched on that, you may not want to go crazy hard if you've never exercised, or just go for a walk is great. That's something I always recommend. But body weight movements are fantastic. You want to be safe with your strength training, your fitness, your exercise. So like doing body weight squats, doing lunges. I don't know. I put this in here, but I put glute bridges. Now you will be supined, like you mentioned earlier, but you don't want to stay down there too long. So body weight movements are fantastic. Even some controlled resistance training. So like using dumbbells, kettlebells, resistance bands. My wife, whenever she was pregnant, she was always active, but she lowered her weights. She did lesser weight. She didn't use very heavy weight. So let's say our specialty, we focus on a lot on kettlebell training and strength training, dumbbells and things with what we do on social media. And let's say she was swinging a 16-kilo kettlebell. Well, she dropped down to like an 8-kilo or 10-kilo kettlebell because of the belly grows. And if you have had more than one kid, it just appears to be bigger and it's harder to move around. And so just making sure that the right amount of weight is the right amount of weight and not going too heavy. I think we said over 20, was it 20 pounds? Probably nothing more than that. And I think you'll know. I really do. When I'm training somebody and they're going through a workout, I know that, hey, go talk to your doctor. They come back and they say you can do everything. And usually it's what you said earlier. We're going to do lower impact cardio. We're going to do things like walking. I love cycling. I think cycling's great. Getting on the bike. Yeah. If you have a Peloton or if you have a gym membership and there's a bike to ride, doing seated bike or regular cycling is something that I always promote. Just something that's very low impact. I don't want you jumping. I don't want you doing burpees. There's modified things that you can do. I know Kate, my wife, did a lot of if we had any burpees in the workout, she literally put her hands on a box that was elevated. So like a 20-inch box or 24-inch box. And then she would just step her feet back and then step up and go back and then up. That wasn't to the ground because we don't want the belly on the ground.
Well, yeah, I mean, you definitely don't want belly on the ground. I think what you said is all like, again, it just kind of speaks to common sense and it is probably overly safe from what I'm even saying right now. And I think that's totally warranted, right? I feel like that's what women should even hear in some ways, that like you're not being overly safe actually by not working out. You could be overly safe with your workout. That's better. Right. You're actually being safer for your pregnancy by working out in an overly safe way than you are by saying, I'm not going to work out because I'm going to have a miscarriage or I'm going to cause my water to break. You're not. And you're actually going to benefit your blood flow to baby.
Because I think that's a big one too. And what you just said from a doctor, you just said it. I think it's important to know that you promote fitness, you promote activity. And people have to realize that you're going to be okay. The exercise, and you can say if I'm wrong, but I feel like the exercise is not going to hurt as long as you do it safely.
Movement is medicine.
Okay, thank you very much, doctor.
Yes,
but this is what, and these are some guidelines. These are just simple things that I really want you to avoid. You know, I don't want you doing heavy barbell lifts. There's no max at first. We're not going to go for 225-pound barbell deadlifts. We're not going to do any back squats that are crazy because I don't want any pressure on your spine. I don't want anything pushing you down. We're not going to sit-ups are out. We're not doing crunches. We're not doing sit-ups because you can't. It's hard.
Yeah.
Why would you try to do that? And then I don't want you on your back.
So that's a big thing too. It's in the back thing, just to be clear too, like that's not you. I want women to know, like outside the first trimester, like you're 14 weeks, like you can do stuff on your back still. It's more about the idea of like around 15 to 20% of women will get like vagal kind of like they will almost like they will have hypotension basically, right? So like they'll stand up from that seated position after that aortocable compression.
I got you.
And that will cause them to get lightheaded. And so then that's not good. But overall, like you can be on your back a little bit here and there. It's just again, it's what makes sense. The first time that you have that lightheadedness, it seems like your body's telling you something.
Right. Yeah. It's telling you to slow down. It's telling you, hey man,
Right.
we need to slow down. Your baby's taking all your oxygen, like you said earlier.
Right.
But I think that's what's important, and even things like overhead pressing. I notice too when I program overhead pressing, sometimes you can't do too much weight because your back, your core
Yeah.
isn't really solid. So you do risk some joint instability.
Mm-hmm.
And so even, you could strain your lower back, but there's nothing wrong with pressing overhead as long as it's a good weight. It's not
Well, and
heavy.
it
You can
seems
still
like funny when you're saying that, like, especially with second and third trimester, you almost should treat like workouts like you're treating like you're almost doing it all around your abdomen as
Yeah.
opposed to your abdomen, right? So, like, you can do all
Right.
your arm stuff, right? You could do all your
Right.
leg stuff. You could do leg press. You could do squats, but like, it doesn't need to be tons of weight. But like, you can still work those muscles totally fine, especially like getting a good curl in, bro. Like,
That's right, dude. It's
like
all
it.
about the curls for the girls.
I
One
don't know
girl.
that they. Oh yeah, yeah,
I'm talking about you, bud.
yeah.
Yeah.
For me,
Yeah, yeah. But this is kind of what I wrote here down, and
Mhm.
you can tell me, hey, you know what, Andrew, you don't know what you're talking about. But this is something like first trimester. What is it? 1 to 12? Is that usually what it is?
1 to
So your
13.
energy,
Yeah,
1 to
yeah,
13. So what I've noticed is like their energy, they vary. Some women feel
yeah.
great, some are exhausted. I noticed that. And so we modify. So keep training. This is something I wrote down. Keep training as usual if you're feeling
Hmm.
good, but listen to your body.
Hmm.
And then a key thing was, like I tell them, hydration is key. You got to keep drinking water.
It is. I had not really said that at all anywhere in here, and like I was trying to find the right moment. So yes, totally agree with that. Glad we plugged the hydration idea. Yes. Okay.
But
Good.
I think that's a big point. So that's like first trimester. Those are the things that I'm really focusing on. So I guess
Hmm.
14 to 28 or 14 to 27, if I'm wrong, but
Hmm. Hmm.
roughly, we're going to modify some things. So we're going to focus on I usually do. I've done planks, but this is where I stopped doing planks. This is where I don't have anybody doing planks, and we kind of switch over to bird dogs. If you're familiar with a bird dog, you're on your all fours. There's no risk of falling. There's no risk of like just losing your balance. And then dead bugs. We very rarely do them, but I still have them programmed every once in a while. But
Yeah.
you're not on the ground for too long. But I think these are
Just
great
get the
things to
bird
still
dogs and
strengthen.
dead bugs in. All right. Get
There it
those
is,
bird
man. Those are
dog
great.
dead
Bird dogs,
bugs.
dead bugs. Go look them up. They're
Look
easy.
it
They're
up.
great. Everyone,
Google
you see them
that.
everywhere. You see them everywhere. Everybody's doing them. Even if you're a golfer to
Everybody's doing-
you're just starting to walk, babies do them,
Yeah.
So, I mean,
Yeah.
just be mindful of balance changes, because that's something too during this
Mhm,
time that I
mhm,
realized with people is their balance, man. So wider stance for squats,
mhm.
lunges can help. So use moderate weight. Like, don't be realistic with the weight usage. We're not hitting PRs here, people. We're just moving. We're just getting strong. We're just
Well,
maintaining our
do you want me to
strength
stand? You
and
want
not
me to
losing anything.
stand up here real quick? Because I'm gonna show you something, bro. I'm gonna
Yeah,
show
go ahead.
you
Go ahead. Let's
something.
see it. Let's
I'm
see
gonna,
it.
I'm
Oh,
gonna
you're gonna
stand up
yeah.
here. I don't know if we're
Go
gonna
ahead.
hear
Let's
me
do it.
perfectly, but
So for those that are just listening, he's standing
whoa.
up and he's got
Okay.
this fancy, awesome
But
camera that
see,
follows you everywhere.
the problem is it shouldn't follow me that far. Hold on. We're gonna turn this camera off a little bit and actually direct it to what we want to do. Boop. Okay. But we are gonna bring it down.
He's moving it around just in case if
Moving it
you're
around. Okay.
listening. He's messing with
Okay.
us.
So, and this is gonna go, and I'm about to share something in a minute too. So, when you're pregnant, center of gravity before you're pregnant, your center of gravity is like right here. Actually, it's more like up here in your body.
Hey, for
But
our audio listeners, can you tell them and give them a kind of description,
okay,
because they
maybe
can't
like
see you?
around the umbilicus or your belly button, or maybe a few inches higher and in mid position, right? So if you like were to cut down the middle of your leg on your left or right side, right? So you go up to that level. So on your flank, you know what your flank is? So like kind of the
Yeah, I
side
know what
of
the
your
flank.
tummy, a little bit above the level of your belly button. If you were to imagine your center of gravity, it's somewhere like behind your belly button, a few inches up. How about that? That's a better way to think
Gotcha.
of it,
I'm with you. I'm with you.
right? Like a few inches behind your belly button and a few inches up. But I'm trying to illustrate for people because, again, what we would end up doing is when you're pregnant, you end up seeing that center of gravity, right? So, like, now I don't know. Okay, I'm pregnant.
He's got his hand in his shirt. That's what he has.
So your center of gravity now is going to shift out to here. So you're also going to lose a little bit of balance effect on that too, right? So just like you're saying, kind of women are more likely to fall when they're pregnant because they are
Right.
not as accustomed to their center of gravity being like this and they have balance issues. That being said, that center of gravity being more shifted out like this, let's go to the next thing I have for us that's like a huge talking point for my patients all the time, as well as just great for recovery. It's also, you could wear it while you're working out. Let me do media and let's, hold on, let me share my screen here. I'm going to share this. If you are listening, you need to basically get looking at the app at some point, but I'm going to show you guys. Do we see this right now? Are we able to see this?
Yeah, I got
Is this
you. I can
showing
see it.
up? Yeah. There we go. Okay. So this is the type of abdominal binder you need. What that's going to do is it's actually going to take the center of gravity that's out here and pull it back in a little bit.
Yeah, my wife
Actually,
wore one. Kate wore one of those.
yeah, I mean, Kate. So my problem too is that like this is what you need right here. It's under $20. You can order it on Amazon. I'll bet the Prime 2-day delivery. There's no excuse nobody can afford this or order this, and it's one of the best things you could have for pregnancy, for both recovery, exercise, just general balance issues, all this stuff. Women want to buy these like crazy, like the ones with like 20 straps and like
Right.
all this stuff going on. Order the basic abdominal binder. This is it right here. Like, I'm not endorsed by this company, or am I endorsing this particular one, but this is exactly what you need. It's been 17,000 times, right? Like, this is what the hospital gives you. This is what we want. This is what has been studied as a medical device and actually has benefit for people. Anyways,
That's
I'm gonna
awesome.
stop sharing
Yeah.
this, but here it is
No,
on
that's
here
great.
just for reference.
I love that, because that's what
Yeah.
we're talking about, balance, and I think also too, just making sure that you're doing higher rep ranges. So anywhere from like 12 to 20 reps
Yes,
when you're
higher rep
working
range.
out. Higher reps,
100%.
just big time hires. So that's like your second trimester, and then your third trimester. This is it's time, we're going home. Okay, we're not really doing too much as far as trying to hit, again, no PRs.
No
So we're just
PRs.
focusing on mobility, personal records, no stability. We're focused on stability, and we're just moving. I love walking. I think walking's fantastic to do and continue to do as much as you can, because I know there's going to be probably some swelling toes and feet and ankles and knees and everything, water retention, the whole shebang. But you just want to just maintain right now. Body weight's great, band work's great. And let's just do a lot of seated, a lot of standing. There's no need to do anything lying at all here. And then,
right, I mean, they can't even
just
get up
don't.
half the time anyway. They're just like turtles, dude, on their shell at that point. I always got to help the ladies up in the office, because it's like kind of like,
we're not making fun of anybody. We're not making fun of
no,
anybody.
I love my patients.
So I mean,
it's
just
a
some
turtle
myths.
status, man.
Yeah.
When you're super pregnant, you're just a turtle, bro. Like I
it's
even
super
say
cute.
it to the patients. Yeah, it's like you
Yeah.
just can't move.
I love
anymore.
that time.
Like you said,
I love that time.
crunches. Nobody doing no crunch when they're 36
Nah,
weeks pregnant.
no. My wife didn't like that time, but I love that time. So debunking some myths. So here's some FAQs, some questions. So lifting weights will hurt the baby.
Never.
False. Right?
Yep, false. Yeah, false.
So strength training, exercise, anything, mobility things, swimming can support a healthier pregnancy. That's what you said earlier. Here's another one. You shouldn't lift over 10 pounds. I think that's also,
that's false.
Depends. It's
it depends,
false, right?
Okay,
but
I'll go with.
Depends.
Sorry.
Hey,
sorry
thank
about
you.
That. They're
Thank you.
cheering for you. You did a good job there. Sorry.
They like that. Thank you very much.
Okay. What else?
But yeah,
what are some other things?
So core strength, like I think this is a big one too. You're going to lose your core strength. That's not true. You just have to modify workouts correctly.
Yeah.
You just have to, functional core work is key, but it's functional. So think about, like I said earlier, think about things that you're doing standing up. Think about, I love machines at the gym. The machines at the gym that are at your gym, start using them. That's a great place to start too. If you're not doing anything, and you can really modify there. And if you get short of breath, you don't have to continue, right? That's what we've been talking about. You have to have some common sense in this. And here's the last one. Strength training will induce labor. Is that true?
Oh,
Is that a
bro.
true one, Dr. Martin?
No, that is not true.
All right. So that's again, it's a myth.
Dude, I just think like some of this stuff, oh my God. Because like I just wish
And guess what?
man,
We have so many
I don't know how to
episodes. We
put
got so
this.
many
It's
things,
just
dude.
like,
We got so
yeah,
many
it's
things.
just like I'm sitting here thinking like it goes back to this idea that and again, patients are not expected to know these things, but I always I think education is one of the most important things physicians can do. And I think trying to explain a misconception by patients, it can be helped by thinking through the logic of like how we approach issues. And labor and the idea of labor inducement or labor prevention is such a still not well understood thing in medicine that like if we knew working out could induce your labor, don't you think that that's like what we would do?
Yeah, that's what you would do, right?
Get on the treadmill and go run a mile and we're going to have a baby. Like, and
Right.
no, dude, like that's just not how that works. So, no, that's the best I can put it. I don't know. That was a
I love
super
it.
long
I
answer
love
to
that.
say, like, no.
Nothing.
I'll just
Cool.
say
Those
no.
are the myths that I had on there because I think that's something
Yeah.
too. And really, like the best thing that you can do if you're so concerned about this is hire me or
Oh,
find a
bam.
trainer, right? Fire
Yes.
me or
What? No, I
fire
agree
me,
with that.
hire me,
I
or
agree with
hire a
that.
trainer, right? Hire a coach, find someone that knows, and ask them, "Have you ever trained pregnant people, pregnant women?" And they'll tell you yes or no because it is a challenge. And I've trained a lot of pregnant ladies. I've trained multiple babies with that. I'm talking about like when they've had multiple babies, and it's
Yeah.
different. It just
Yeah, and I
depends.
gotta tell you, like that's the weird thing I find is like I would say both of those things are true. Like I would want patients to go to a fitness trainer who is comfortable with pregnant patients. Now, what's scary about today's day and age is how many people will profess a comfort and it's out of pure ignorance. And so what I would
Yeah, you got to
also
watch it.
right. But I would also ask is that patients, if they're asking to do their own due diligence and find this stuff out, is then put the person on the spot and ask them how many times it like, again, when people ask me how many babies I've delivered, I'm like, look, I can't even tell you anymore. It's like 10,000. Like, you don't have to have a specific number, but if they're kind of like, oh, I did this girl like a year ago, it's like kind of, I don't know about that. Like, I want you to they either got to be a sociopath and just lie so quickly. But I deal with hundreds, or they're going to tell you their honest fact and their experience with it. And I think that's going to help you bore down on who really you should be seeing to take care of you while you're pregnant. And there are fitness trainers who are well versed in and comfortable taking care of pregnant women. And then I think there might be some out there that say they know what they're doing and might be unsafe for you. Don't know all. Like we have just talked for an hour about this topic. And I guarantee you there are fitness trainers out there saying they're comfortable with pregnancy that are doing some of this stuff. Or that
Exactly.
tell you shouldn't work out at all. Or that tell you, whatever. And so that to me is hard to know who is ignorant. And ignorant's not a bad word. It means a lack of knowledge. But who is ignorant to this topic and who actually understands this to a degree that they can profess competence in it and actually practice it.
Yeah,
And
because
keep you safe.
even before you got to Abilene, I worked with one of
Mhm.
your colleagues for a long time, and what
Mhm.
I did is I literally I had this like assessment consult like sheet of paper with exercises on it, and I gave it to them, and they looked it over and they wrote on it like don't do, can do, and because I wanted to get better, like because I was
Mhm.
training a lot of
Mhm.
pregnant women, and I wanted to make sure
Mhm.
that every single one of them was taken care of. And if an
Mm.
ob-gyn and
Can I
if an
ask you what colleague
ob-gyn
that was? Let's talk about what colleague that was.
oh yeah, it was Dr. Whitney Mascaro.
Okay, I
Yes,
love
yes,
Dr. Whitney
yes.
Mascaro. She is a good OB, and she can definitely speak to those things.
Right,
That's
right. And
great.
and so I had
She's as
everything
into
written
fitness
down.
as you and me are, if not
Yeah.
more so, man. So
And I guess
I love that.
my qualifications is that I train ob-gyns, so it's
Yep.
definitely something that probably
You
helps. And
sure did.
I think I think it's okay to say like that's why I said you have to find someone that works best for you. And if they get you down on the ground and you're doing a burpee, that's not probably safe.
Mhm.
And if
Mhm.
they're taking it slow, because the good trainers, what they'll do is they'll ask a ton of questions. And the first question that they will ask you, and this is big. The first thing that they'll ask you is, have you spoke with your doctor?
Yeah.
Have you talked to your doctor? And they won't ask, like, bad ones won't ask that
Yeah.
because they got you in front of you. But I have sent people away. I won't train them. I've done it at least 10 times. I'm not kidding. And I'll go, okay, have you had an appointment with your doctor yet? Well, I can't train you today.
Yeah. I
I'm being
mean,
serious.
that
I'm being
right.
serious
There's no
because I don't want to hurt
there's
her.
a lack of accountability in a lot of professions. That's the funny thing about medicine. I was talking to a laborist last night when I was at the hospital doing a delivery, and I find that OBs are one of the few specialties in medicine, even. And most people in medicine are true believers, is what I call it. Like people who do this because they love what they do. But the obstetric field is truly a labor of love. Like you do not let this impact your life this way without doing it because you absolutely love it. And so I just find that, like, not using the person that's literally there to make sure they're going to be safe is a mistake. And it also doesn't translate like that. One of the things, again, that kind of goes back to this idea of TikTok influencers versus your doctor is that there is no accountability. There is no repercussion. There is no professional standard to which any of these people are held. It doesn't mean that's the only thing we care about, but like that's why doctors are doctors, is because like ultimately, again, like we keep ourselves and police ourselves to a higher standard, and we are held to account for that. If we don't
Absolutely.
tell you what's safe and do what's right for you, there are channels and ways in which you can address that. And again, fitness trainers, it doesn't really usually fall to that level of high fidelity and like,
No, it doesn't.
you know?
It doesn't. It
So
doesn't
like, I
because
mean,
no.
that's like also, like again, I hate to like bash on something else right now, but that's like people with chiropractors a lot. Like I don't understand. There are good chiropractors out there, but they understand their limitations. But then there's also chiropractors who do a lot of things that they shouldn't really be doing and recommending for you guys. And this kind of goes back into fitness a little. We can address this more on
Right,
another
right.
one, but that field doesn't have to take responsibility ultimately a lot for the things that they recommend and the supervision they're professing to have over you. And there's a difference for that as a result of that. I mean, they can be very cavalier with your health. And when something really bad happens, they're going to be nowhere to be found. And you're going to have no repercussion to address why they told you that.
Yeah. And
Physicians
my
have
big
to keep themselves accountable.
and my big thing is and this is something I was thinking as you were saying that was if you're in shape, if you're healthy and you're a doctor, I'm going to respect you a lot more
Yeah.
than if you're old
Yeah.
chubby over there. And I'm not saying
Right.
I'm not talking about
You
having
got
a
a
little just a little
glandular
fat.
thing or something.
Yeah, yeah. Okay. I'm not talking about that, but I'm just saying it comes
Right.
off way better when I look
Mhm.
over and I see a doctor that's in shape, takes care of his health or hers. They're going to
Yeah.
give you way better advice, I think. And
Mhm.
I'll take it. You can't say anything, but I'll say it. And I think that's where you being as fit as you are, you're gonna help that patient as much as you can.
Mhm.
And you're gonna set them up to succeed. So that's what I think. Mic drop.
Yeah, mic dropped. And again, there are people who can look and appear very fit too, but like that is not me. There are those people out there, but I will say again, I have had my own struggles and journey with fitness and getting to a much healthier place and maintaining that. So yeah, I agree with that too. I don't think it comes off well for a obese physician to talk to you about your diet and your exercise regimen. I feel like why? I mean,
Exactly.
you profess to be an expert in health and wellness, and then you are not in a well place.
Right.
So yeah. I agree.
And that's for the next episode, leaning going going forward for that. But
What
let's
is the
recap.
next
Let's
episode? Let's recap. What are we gonna do next week, bro?
Well, I just think next week we're going to have to keep going. We're going to have to keep doing this. We're going to keep talking about pregnancy. We're going to keep talking about training. We're just going to dive even deeper into it more. There's a lot of things we can talk about,
dude.
Yeah,
I mean,
dude. We can talk about
bro,
pregnancy affects strength and muscle mass. We can do.
Oh
You could
my
talk
God.
forever, dude. Are you kidding?
Per trimester, bro.
I'm telling you, you could talk about first trimester, second trimester, third. If you want a fourth or a fifth or a sixth. Postpartum. No, that's awesome, man. I think this episode was great. I think it was good. I think we nailed it. And you know what? People are gonna have to press the stop button and the play button and the stop button and the play button because we talked and we were excited about this. And I really think this is a great way for episode 1 of season 1 to kick it off. And we're gonna have people on here and we're gonna interview people and we're just gonna keep going. Don't forget, please, if you are anywhere, subscribe, like, share everything.
Post it on whitehouse.gov.
Ooh, they'll come. I want them coming after us. Let's go. Come on.
No, dude, you gotta like it. You gotta subscribe. You gotta share. We want to do this because we want to do this, guys. So I hope you guys enjoyed it. I hope you guys understand that most of the stuff we're saying is based in absolute fact and recommendation and general knowledge, as well as we prepare each week for these episodes. So we do not come at you with a bunch of freaking just basic opinion. Again, I know an opinion from a fitness trainer and a doctor is going to be good, but I do my homework every week for these podcast episodes. I know Andrew does too, so that we're giving you really relevant, really good information to reference, to be able to share, to be able to use as a basis of why you should be doing this or that. But the only way we're going to know also what you guys like, what you guys think, what you guys want to hear about, the questions you have, we could literally have episodes based on questions alone, is if you feedback to us on either my professional page, which is Dr. Stuart Martin. You can find me on Facebook. Eventually, you'll find me on Instagram. I'm going to switch over an old account I had that was more based on video gaming.
He's an old man. He's still on the ancient. He's sending smoke signals across the way.
So you'll find me eventually on Instagram. You can find Andrew Bustos on Bustos Training, and he's on like Instagram, Snapchat, Facebook, blah, blah, blah.
TikTok, YouTube, Pinterest,
Grindr,
what else?
Probably, dude. No,
website. We also have a website, bustostraining.com. So go check it out. Also,
there you go.
Thank you for listening.
Yeah. We love this. We love you guys. We love the feedback. Even if it's negative, tell us how we can do better. Tell us how we can improve. We're excited to keep doing this. Anyways, I guess Andrew's signing off for the night. So we are going to say a happy farewell. Go Cougs.
They just won 69-50.
There we go, bro.
There you go. Final four.
I got them to win the tournament. So
hopefully
we'll see how that goes.
Win some money.
Week.
Let's see.
Hopefully I win some money.
Thank you guys for listening.
We love y'all. Have a great week. Be healthy. Be safe. Bye.
See ya.